أهلا بكم. My talk today will be about the epiploic appandagitis. Epiploic appandagitis is one of the very important cases that radiologist is playing a very important role in differentiation between the medical and the surgical causes of acute abdomen. Before talking about the epiploic appandagitis, we have to know first what are the epiploic appendages. Epiploic appendages are finger-like fatty projections arising from the surface of the colon, more concentrated in the region of the rectosigmoid. Its length is ranging from 1.5 to 3.5 centimeter, as you see in this image and in this image. Why we couldn't appreciate the normal epiploic appendages on CT of normal abdomen? This is because they are fatty structures against the background of intra-abdominal fat. That's why we couldn't recognize it on the CT of normal abdomen. But we can appreciate it very clear in cases of marked ascites. Here they are projected against a background of intra-abdominal fluid, as you see in this image. So what is the pathogenesis of epiploic appandagitis? It is thought to be due to torsion of one of these epiploic appendages around itself, resulting in ischemia and necrosis. The patient present clinically complaining of severe lower abdominal pain and gardening. If it involves the epiploic appendage on the right side of the colon, it will be confused clinically with the acute appendicitis. And if it involves the epiploic appendages in the left side of the colon, it will resemble the clinical presentation of acute diverticulitis or ruptured cancer colon. The epiploic appandagitis is a self-limiting disease, treated with only conservative treatment in the form of non-steroidal anti-inflammatory drugs, and very easy to be diagnosed by CT scan of the abdomen. So this is the importance of CT scan, as the correct diagnosis prevents unnecessary surgery, as in the other surgical causes of acute abdomen, like acute appendicitis. What are the features of epiploic appandagitis on CT scan? The CT appearance is usually characteristic, consisting of: number one, fat density of void structure adjacent to the colon, as you see in this image. Thin, high density rim, as you see here, and sometimes surrounding inflammatory fat stranding, in addition to central hypertension dot representing the thrombosed vascular pedicle, as you see in this image. So this is the classical CT features of epiploic appandagitis. Now I will show you one case for epiploic appandagitis by CT scan. This is a CT scan for a male patient 50 years old complaining of severe left lower abdominal pain with abdominal gardening. His clinician suspects a possibility of coronary diverticulitis or perforated cancer colon. CT scan was done with intravenous contrast administration, revealed, as you see here, multiple diverticula seen in the sigmoid and the descending colon, as you see here, and here also. There is no evidence of any thickening of the wall or pericolonic mass lesion to suggest diverticulitis, as well as there is no evidence of any colonic mass lesion or signs of intestinal obstruction could be seen. Adjacent to the lateral aspect of the descending colon, as you see here, there is a fat density mass with thin high density rim. You can appreciate also that there is significant surrounding inflammatory fat stranding, as well as central hypertensive area representing the thrombosed vascular pedicle, as you see in this image. This is a classical feature of epiploic appandagitis. So this is everything regarding the presentation and diagnosis of epiploic appandagitis by CT scan. Thank you very much.